Day, friends of Buzzy. Welcome to the currently vaccinating era. Today, we are going to talk about two big issues with getting to herd immunity. We're going to talk about the math later on, but first, we're going to talk about some practical guidelines, which we will post in our Facebook page to help you get your hospital staff and potentially nursing home staff vaccinated smoothly so we can get started. There's a lot of research on vaccine refusal and fear, but most importantly right now, there's also a good bit of research done by a guy named Chris France in Ohio looking at who comes back to donate blood after the first time. It's an amazing wealth of knowledge. Tens of papers, huge numbers of subjects, over thousands of people donating blood. And they've been able to find out what impacts people being willing to come back for the second time. So it turns out with the Pfizer vaccine that if you only get one injection and not two, you only have about a 50% efficacy of the vaccine. Now that's important for a couple reasons. One reason is because we need 70% of the population to be immune for herd immunity to work. Some people say 80%, depending on the day. Fauci goes either way, but it depends on how infectious the virus is. And with what we know right now, in the wintertime, we probably need 80% of people vaccinated or immune. Summertime, it's probably more of a 70% because the infectiousness is different at different humidities and temperatures. Regardless, that's kind of the goal we're looking at. So looking at the information from Chris France's work, there were a number of things that influenced whether or not someone would come back to give blood a second time after the first time. And they were all about the needle. Anxiety was correlated with more fainting feelings, which was correlated and was also correlated with more pain. That led to less likelihood of coming back to ever give blood again. Anxiety and low blood pressure were related to fainting feelings, which were related to being less likely to come back. All of these different things kind of combined together, but the important thing is that there is a non-zero number of people who will not come back for the second vaccine. Now, other things we can look at to try to figure this out are who comes for their second shingles shot. So both hepatitis B and shingles vaccines and HPV, human papillomavirus, all of those require multiple doses to be active, just like the COVID-19 vaccine. So looking at all of these different pieces of math, we can kind of get an idea for what will give us the right expectation for what we need to do to figure out how to get everybody vaccinated. So first of all, with the shingles vaccine, depending on whether or not you're going to your doctor or going to a pharmacy, between 59% and 70% of people get their second shingles vaccine. If you look at the hepatitis B vaccine, it's only about 56%. And if you look at HPV, the human papillomavirus, that one is highly related to whether or not people fainted or got woozy when they got the first shot. Now, it is teenagers, but the number one reason people don't get their second HPV vaccine is because of needle fear, which is related to pain. So putting all of these things together, what kind of math can we expect? Well, luckily, in the healthcare community, you are much less likely for those first people getting vaccines to be afraid of needles. And you're also much less likely for them not to get their second vaccine because they can't work there unless they get both of them. And employee health has a really good location of finder to get everybody to come in and get vaccinated. Nonetheless, every year, getting people vaccinated for flu shots in hospitals is still something that is difficult. So we put together a best practices model incorporating both the data from Chris France and the information that we have from work with Buzzy and also from work with vaccine and needle phobia that can be a quick rubric guideline that you can post to help when you're getting people on your ward vaccinated. The linchpin of this starts with the fact that Chris France found out that if you ask, how afraid are you of having blood drawn out of your arm, people tell you. And interestingly, bringing that up did not correlate with more likelihood of passing out or feeling woozy or weak or reporting pain. It actually was somewhat protective. So this is what we believe is the right way to go about getting people vaccinated on your ward and giving them a good experience if they're the person who's likely to not come and get their second one when they need to. So with my fine graphics department, this is how we'd start. Ask them while they're standing in line, how do you feel about needles? If they say fine, great, then sign their little form and send them on. If they say anything negative, like, oh, nobody likes needles, or, well, I'm not great, or, well, you got to do what you got to do, then ask them whether or not their problem is anxiety or pain. Now, if they say, actually, I get lightheaded, then you go in a different direction, because it turns out that drinking 16 ounces 1 hour before a blood draw, drinking a caffeinated drink, or sitting like this to push some of the blood that's in your leg up into your brain, those are things that can decrease the likelihood of passing out. But if they don't like pain or anxiety, very simple. Just have a stack of Buzzies and put a Buzzy XL for 1 minute on their shoulder. Let them hold it themselves. So you don't need anybody in your office to do it. Just say, great, hold this. Now, is the pain a problem or lightheadedness? If pain is a problem, add ice to it, because ice is going to add additional pain relief. For IMs, it could be as much as 50% of the pain relief. So when they're actually getting the injection, that's when you want to help them deal with anxiety. They're going to keep holding the Buzzy in place and give them something to focus on. One thing that we've discovered that's a nice cognitive distraction is to have someone, while they're holding their Buzzy, here, let's do a cute one, while they're holding their Buzzy in place, have them look at any sign that is on the wall and count the number of letters that have holes in it. It's something that's good to distract the brain because it requires concentration. No one's used to looking at letters and seeing if it has a hole or not, and it allows them to count, which is something that is rote. By the time they figure out that a B has a hole but a T does not, they're usually done with the injection. Let them hold this until they don't feel lightheaded or woozy. Off they go. All right, so it may seem silly to add this step in a healthcare environment, because these are doctors and nurses and none of them are afraid of needles, right? Wrong. What is really interesting is that they're less likely to admit to being afraid of needles, but there are still people who work in healthcare who either pass out or don't like needles. It's a smaller percentage than the 28% of adults. So in general in our society, over 1 in 4 people do not like needles. And of those who don't like needles, someplace between 23% and 36% won't get vaccinated because of that. So these are numbers that are a little bit hard to look at or to hear about, but let's try to look at them in terms of our herd immunity. All right, so here is what we need for herd immunity. So let's say that we've got 350 million Americans. That means that we need all of this group right over here to be vaccinated. We need all these little pieces. We need those to be vaccinated, because what we need numerically is 245 million Americans to be vaccinated. So say we got 350 million, we need 245 to be immune. Now you say we're already up to 15 million who have COVID or have had it, and immunity lasts for some time. And by the time we're hitting March, when we're really looking at herd immunity, that's going to be probably 30 million. Okay, fine. So I'll give you that. This little sliver right there, that little sliver is the people who are going to be immune because they've had the disease. but it really isn't going to be 30 million because the immunity that comes from getting the disease is only about half as effective as the immunity that comes from the vaccine. So if we assume that 30 million people have caught COVID by then, only about 15 million are going to have a reasonable immune response that will contribute to herd immunity. All right, so now we've got that. Let's say, okay, so we've got, these are the Moderna vaccines. So we've got 100 million, sorry, Pfizer, we've got 100 million Pfizer vaccines. That's 50 million people. Then we've got Moderna, and so we've got 100 million Moderna, 200 million Moderna, so we can get 100 million. So now we've got 150 million people vaccinated. And of these, we need to get to 245. So if we add our Pfizer and our Moderna and are already ill, we still need to get about 60 million people vaccinated. So 60 million shouldn't be a problem if we can add more Pfizer vaccines, more Moderna vaccines. The problem comes when you start factoring in all of the people that either are not going to get their second one and only going to be half protected, or the people that are afraid of needles to begin with. So then you get to a place where we need all of these people to be vaccinated. But in reality, this group, and that group are either going to be too afraid to get the first shot, they're not going to come back for their second shot, or they're going to have a decreased immunity because the vaccine itself is actually not 100% effective. It's only 90% effective. So you've got to take away an extra 10%, even those with vaccines. All of this is to say that we really can't get to full herd immunity quickly unless we account for those people that are not going to come back for that second vaccine. Because once we're out in the community trying to vaccinate that 60 to 80 million extra people that we need, depending on how well it goes with healthcare workers and with the elderly and people in nursing homes, once we start trying to get that 60 to 80 million, we're going to have 12% that won't come get the shot because of fear, and we're going to have about 40% that won't get their second shot. So they're wasting a first dose and they're not going to be there. I take you back to our initial thing. We recommend that when we start vaccinating the general population, we still follow this same concept. How do you feel about needles? Are you afraid of fainting or pain? Let's do something that takes less than a minute to intervene. All right. So this has been a jolly mathematical exercise. We are still putting our pie charts together so that you can see what the implications are for non-compliance with the second vaccine and with issues with pain. But to go back to Chris France, when you deal with anxiety, you can actually improve returning for that second procedure by 38%. If you deal with lightheadedness, vasovagal syncope, feeling woozy after a shot, you can improve the people coming back almost another 30%. And if you decrease pain, then you both decrease anxiety and you decrease the lightheadedness. So all of these things come together to really give a fairly simple schematic on a way to not waste our vaccines, get more people in the general public to come out and take their vaccines so we can get to the 70%, and try to do this as soon and as quickly and as painlessly as possible. As always, please give me any questions and we will address it later. I have another video that talks about why going for natural herd immunity was a really bad idea. And if you want to know more about COVID as it hits the presses, please join us every Wednesday Eastern Time, 3 p.m. We're not quite there yet, but I am very sure that it's going to be fine.